Hi, I'm David King-Lassman. This is ExploreXR, and today I'm absolutely thrilled to be joined by the brilliant Anne Lord Bailey. Anne, hi, welcome.
Hi, David. Thanks for having me.
So, Anne, you are the Director of Clinical Tech Innovation at the Department of Veteran Affairs. But before we talk about that, I want to know a little bit more about your background, because you weren't born a technologist, right?
That's correct. I actually am a pharmacist by background. So I joined the VA first as a student when I was in pharmacy school, and then as a resident my first year out of pharmacy school, and focused initially on hepatitis C, actually, and was one of the lead providers for hepatitis C treatment across VA in the last 5 or 6 years when VA was really focusing on that. But as a part of working with hepatitis C, we actually had opportunities to change how we thought about delivering care to veterans. And that's something that VA is always in the space of, is thinking about how do we do things differently and how do we do things better. And so while I was working with hepatitis C patients, was able to work with a team to develop a rural clinic where we would take mobile medical units into the field, and we would go to veterans, and that way they didn't have to make those long travels. And because of that, got on the radar of some people that were leading healthcare innovation, and was able to start an innovation program at the Western North Carolina VA in Asheville, North Carolina, and then eventually joined the national team in the VAs Innovation Ecosystem as their Director for Clinical Tech Innovation.
Well, okay, so we're going to come back to that in a little bit, but I mean, I think when I was doing a little bit of research into this discussion today, what blew my mind was really understanding just how huge the Department of Veteran Affairs is. And I noted today that the 2023 budget is $301 billion, which is a lot of money coming into this organization. Can we talk a little bit about the VA? Because I think most people who are going to be listening to this don't really know how big it is and how it functions. Can you give us some insight?
Sure. So the VA, it has over 170 medical centers. It's the largest integrated healthcare system in the country. We serve about 9 million veterans and actually participate in training about 70% of healthcare professionals. And so we have a huge opportunity to impact and influence healthcare in general, both from the professional and from the patient perspective. And we look forward to continuing to grow that influence.
And one of the things that I was blown away by when I came down to visit you in Orlando recently was just how kind of shiny and new your center is down there. You really are at the cutting edge of medical technology and innovation.
Absolutely, it's super exciting. Executive Director Eric Bruns of SimLearn was incredible to allow us to come down there and see his facility. Is definitely one that continues to be on the bleeding edge of healthcare and tech innovation. But our office, so just to back it up just a little bit, VA is a huge organization, as you mentioned, Department of Veterans Affairs, and underneath that department, there are three main arms, and that's the National Cemetery Organization, the Veterans Benefits Administration, and the Veterans Health Administration. And so in this conversation, we're talking specifically about the Veterans Health Administration, and that's where we are the largest integrated healthcare system. And within the VHA, the Veterans Health Administration, we have program offices. The office that I work for is the Office of Healthcare Innovation and Learning. And that is absolutely an appropriate name for us. It's what we focus on. And underneath our office, there are three programs. And I always feel like I need a whiteboard to map these things out, but hopefully and articulating clearly, underneath our office, we have a Center for Care and Payment Innovation, where we're really working to rethink business models and care models, as we know that emerging technology is changing the way we think about healthcare. We also have the VAs Innovation Ecosystem, where we work really hard to build the innovation muscle of our frontline staff. We want them to be the ones, frontline staff and veterans, to be the ones that identify problems and present solutions as the end users. And we want to resource them and support them in that. And then finally, SimLearn. And you were able to visit the National Simulation Center there in Orlando, Florida, which is a really important location for us And it's where a lot of the thought leadership comes for how VA thinks about clinical simulation and training. And similarly to having over 170 medical centers, those medical centers all have simulation sites within them. So we're working really hard to make sure there's good connectivity and interoperability between all those simulation sites.
Right. Okay. So let's talk about simulation here. Can you give us some insight into how the VA thinks about simulation and how it applies it?
Sure, absolutely. Well, I think having a program that is called SimLearn, right? Simulation, Learning, Evaluation, Assessment, and Research Network. We've shortened it to SimLearn, shows that there's a priority and an emphasis there. And that organization, that program has recently come under our office and is really going through a rebuilding and restructuring process to make sure that VA is on the forefront of clinical simulation and training, whether it be internal development or collaborating with vendors and other thought leaders, industry, academia, so that we are offering to our clinicians and staff the best of the best when it comes to clinical simulation. We want to make sure that we're also decentralizing it. So we do have a National Simulation Center. It's a really powerful footprint for VA there in Orlando, but we want to make sure that things that we learned in the pandemic carry forward into the future of how we think about that clinical simulation, and we're able to decentralize it and enable and empower our staff to be on site at their own medical centers, but learning the best of the best when it comes to simulation training.
Okay, that's fascinating. And you mentioned the pandemic. How did the VA respond outside of its kind of own auspices of work? So, you know, your remit is to look after veterans, but the pandemic was a national, in fact, a global situation. Did the work that you were doing there extend and bleed into the wider medical profession?
Absolutely. That's a great question. So VA has what's called the fourth mission, and that means that in times of pandemic or crisis in the country, we're able to actually open our doors and support the community to make sure that everyone has access to healthcare. And VA is a large learning organization. And so because of the number of patients that we serve and the diversity that we have and the fact that we have such a large national footprint, we want to make sure that as we're learning things, we're sharing things. So not only are we providing care, we're also providing lessons learned and driving healthcare forward. So if you think back about some of the things that we now see as commonplace in healthcare, things like BCMA barcoding and liver transplants and even nicotine patches, those actually started in VA among a lot of other things. And so I think there's a good precedent that VA actually, and innovation in VA actually informs the direction of healthcare going forward. And we want to continue to play that role, both as we learn and impact the care we deliver to veterans, but also as we influence the broader healthcare community.
That must make it incredibly exciting and fulfilling to be part of that, knowing that you're having such a positive impact.
Absolutely. I definitely wake up every morning excited to get to do the work that I get to do. I understand that not everybody has that privilege or opportunity, and so I want to continue to be grateful for it. But VA is an exciting place to work.
So, Anne, let's come back to you here. So you're Director of Clinical Tech Innovation. How easy was it for you to make that leap from being a medical practitioner to being a tech innovator?
That's a great question. So one of the exciting things about VA is that innovation is in the fabric of who we are. And also potential for growth professionally is just who VA is. And VA offers some really powerful opportunities. I'm actually the only pharmacist in our office. And so it's exciting to be here as professionally to share that with other pharmacists, the potential. I think nurses do that sort of jumping from one thing to another really naturally, and pharmacists haven't done that historically as much. So it's great to be a part of paving that path and showing the potential of pharmacists in other places. But when I was helping grow and build the innovation program in Asheville, one of our main innovators actually started a virtual reality program in an inpatient unit, post-surgical unit. And so I got to be there to support her as she built that program and then help socialize that program nationally so that it could spread across all VA. And then together we started to work to build, as I moved into a national position, we started to build what we now call the VHA's Extended Reality Network. And that is a group of VA staff, leaders, frontline staff, anybody basically within our system who has any sort of interest in extended reality. Of course, this audience is very familiar, but when we talk about that, we're talking about augmented, mixed, merged, or virtual reality. And so that network has continued to grow, and we have a Teams channel. We have monthly community of practice calls to keep sharing knowledge and opportunities and things like that. And we now have publications in our group, and we have over 900 frontline staff actually engaged in that community, and 142 of our 170 medical centers. So we're working for full saturation, but it's a really exciting, rapidly growing group of people.
That's amazing. And of course, as you say, extended reality covers all of the realities, but virtual reality has been around for some time, and I'm guessing that it played a pretty powerful role within the VA. If we think about things like post-traumatic stress syndrome, I'm sure that kind of technological innovation was pretty valuable in helping to treat veterans with that condition. Do you have some insights into how VR has been used historically in the VA?
Absolutely. So VA started using VR specifically about 4 years ago, 5 years ago. And Brave Mind is one that we started using for prolonged exposure with PTSD. And there's one that continues to grow across our medical centers. But we also have about 25 different use cases for virtual reality in VA right now. The most common probably being pain management, that being acute and or chronic, or acute on chronic pain management. We've seen great benefits in each of those. We're also using it increasingly for other mental health challenges, anxiety, boredom, isolation, things like that, to decrease some of the negative behaviors that we see in patients in our community living centers, which to outside VA, it would be very similar to a nursing home or a long-term care facility. We call those our community living centers. Increasingly, we're seeing interest in use of VR for rehabilitation services, so physical occupational therapy, things like that, and even for employee wellness to prevent burnout. We're seeing some great opportunities with our staff who take 15 minutes of positive distraction in virtual reality. And we see that strong impact. We're seeing improvement in treatment-resistant depression, where we're using virtual reality before or after some therapy. And some of the most exciting things we're learning outside of just the specific improvement in outcomes for our veterans is the fact that, and this was actually published in a paper by Caitlin Rawl and some research that she did in VA that showed that veterans who use virtual reality then are actually open to other non-pharmacological modalities as well, which we all know is incredibly important, right? As a pharmacist, I'm one of the first ones that says, let's not start with drugs. Let's start with other things that may be more helpful and then get to drugs when we have to. And we've learned that virtual reality is a really powerful tool in that space.
Yeah, I mean, that's great because it heightens efficacy, but it also does it in a cost-effective way, which is a double win, of course. So let's come on to mixed reality and augmented reality. You're beginning to see this seep into the way that medical professionals are being trained or practicing. How do you see mixed reality today within the VA driving benefit?
So one of the most powerful mixed reality programs that comes to mind for me is by Dr. Tharu Anaswamy in Dallas. And he is actually using mixed reality to help with phantom limb pain, and has seen veterans who not only engage in care, but also ask for additional opportunities to receive therapy, because they're seeing and feeling and experiencing that benefit, which I think is really powerful. One of the ways that we're seeing augmented reality used is not only in clinical simulation and training, but also in education. Can we use it to help people better understand anatomy? Can we help them better prepare for surgical procedures and things like that? So we talk not haphazardly about the fact that with XR, the possibilities are limitless. And we want to continue to explore those possibilities and work together, not in a silo within VA, but we want to work together with industry and academics and nonprofit organizations, people that are interested in this development and growth. We want to work together as a community and share what we're learning, share where we see gaps in knowledge or where we see opportunities that we could explore XR as a solution, and then work together in a broader healthcare community to help solve some of those gaps.
And if we think about mixed reality compared to virtual reality, for instance, where do you see mixed reality playing a more critical role or having more a stronger value proposition in the work that you're doing? Because there are things that you can do in mixed reality that is harder to do when the physical world is occluded from your view.
And I think that captures exactly where it's a little bit more unique, right? So from augmented to mixed to virtual reality, you get that increase in immersive experience. And that would be the most important factor, I would think, when you're deciding whether or not you're going to pursue augmented reality as a solution versus mixed or merged reality versus virtual reality is, to what degree does the person need to be immersed in the situation and distracted from actual reality versus continuing to be engaged in actual reality and what's going on around them? We are seeing much more use with patients currently with virtual reality, though we're increasingly seeing opportunities to use mixed reality or augmented reality in other spaces as well. Phantom limb pain, I think, is one of the most powerful now, but I expect that to continue to grow.
Right. So of course, we're seeing from our perspective, tremendous enthusiasm for mixed reality in the training of doctors. And you mentioned that there's a huge component of what you're doing at the VA in training doctors, nurses, other physicians and support staff, right? Let's talk about how mixed reality is going to play a role specifically in the training of medical professionals within the VA.
Yeah, I think that's really critical because it's been one of the hesitations with using extended reality for training. And that is great, you can see it in your head and maybe you can even manipulate hand controllers, but is there any tactile response, any tactile interaction, any feedback, anything happening that actually feels like when you're in a surgical suite and you have to cut, it matters how deep you cut, right? So we can't emulate that just in a headset. There needs to be more interaction with the external environment. So that's where we see augmented and mixed reality playing a really key role, is where we're able to provide visuals and training and experiences that are experienced as real visually, but also felt real and from a tactile perspective.
One of the things that I love about the VA is the way that it interfaces with companies, like ours, like many great technology comes out there to help drive innovation. That's a pretty big tenet of what you guys are doing, that sort of relationship between business and the VA, right?
That's a critical piece. So what we know is that we have a lot of patients, we have a lot of diversity, we have a lot of complexity, and we have a lot of knowledge within VA. VA does a ton of research, we do a ton of innovation, but we also recognize that we can't and shouldn't be doing this on our own. There are people outside of VA that are already diving into development and diving into those spaces, and so it makes more sense and it's more powerful. It's a force multiplier for us to work together with industry and with the other government agencies as well, with academics. We want to do what's best for veterans first. That's our first priority, but for the broader healthcare system and community as a whole.
And which is great because, the research dollars that you put into that kind of innovation is driving technology at an industry level that is going to benefit the wider community on a global basis. So I think the role that you play is critical, and it feels like money well spent from the government's point of view.
Well, I appreciate that perspective. We think so, for sure.
So let's think about the future. We know that you're an innovative organization. We know that you're always trying to, drive standards. Where do you think mixed reality is going to go over the course of, the next 12 months, 24 months, 5, 10 years?
I think it's a great question. You know, it's funny because we've felt such rapid growth with immersive technology in general across VA. Even if we look back at the last 6 months, I mean, it has truly been an avalanche effect. And I think maybe this is me being more cautious. I've thought, okay, we're going to hit a plateau at some point, and then that will be our foundation, and we'll grow from there. And that has not at all remotely happened. We continue to see rapid multiplication of sites that are interested, of clinicians and frontline staff who are interested. The veteran feedback is really what's driving this and has been very powerful. We're having more and more conversations with people who are intricately involved in policy and in procurement and in privacy and information security, things that really reflect that VA is beginning to think about immersive technology as a core fiber of who we are. And so I expect to see over the next 6 to 12 months, and definitely 5 to 10 years, that immersive technology will only grow across VA and really get to the point where it becomes, in some cases, standard of care. And that as particularly as extended reality improves and mixed reality becomes more of a commonplace modality, as well as virtual and augmented reality.
Yeah, you mentioned previously that you know, one of the constraints that we have currently with extended reality is that you don't necessarily have that haptic response. In virtual reality, you've got controllers, so your hands aren't free. At least with mixed reality, you have the benefit of being able to use your hands. If you could wave a magic wand and you know, what was technologically possible had no limit, where would you see mixed reality playing a kind of vital role if you could combine, say, haptic technology with immersive technology?
Yeah, I think the haptic piece is what's really critical. I think my suspicion is there are things in development or that will be developed that we don't yet have visibility on, that will really transform how mixed reality can influence that clinical simulation and training. And so I'm eager to see those things come to bear, and would love for VA to be a part of that development and growth as well, because I think, again, we have such a broad span of clinicians and frontline staff that we can really give some really, really valuable insight and valuable feedback to that development process. But I think that's the piece that we really want to see, is how immersive technology in combination with things like haptics can make a person with a headset on feel like they're in that actual real world space without putting at risk any person, any animal, anything, and have that really powerful training experience.
Well, hopefully that will happen within our lifetime. I'm sure it will.
I think so.
So listen, this has been fascinating. I've got such a brilliant insight into the VA. Do you see yourself, and maybe you can't answer this given that your employers might be listening, but do you see yourself staying within the innovation side of the medical profession within the VA, or do you miss the kind of the clinical side that you once part of?
So that's a great question. I actually still get to do, occasionally get to go into the medical center and see patients and interact. There's a medical center, I think one of the best medical centers not far from my house. And so I still get to go and have sort of engagement and conversation and interaction. And that's really critical to me. It's really important and very foundational to remember why I joined VA to begin with, and also to remember and keep at the forefront of my mind what it's like to work at a medical center, which is very different from someone who's working in an office somewhere else or at home or things like that. It's a very different world in a medical center in a great way. And so I try to make that a regular part of my schedule, to just go by and have those conversations and interactions. And it's one of the things I love about VA is how excited veterans get to come to be with other veterans and with their healthcare providers. And so I'm very honored to be a part of that. And so to answer your question, I plan to stay with VA and in innovation as long as they'll have me. So.
And I've got to ask you about the sign behind you. I'm trying to work out what it says. Does it say above all things, live each day deeply?
Close. It says above all else, love one another deeply.
Okay. Either way, I think that reflects very much how I feel about you. When I first met you, I was inspired by how inspired you are. I can see that you're somebody who really cares very deeply about how innovation can drive our well-being. So I think, and given that you're employed by VA, thank you for that service that you provide. And I think, you know, one of the things we can take away from this is to feel more deeply about how important the role of the VA is, not just in the welfare of veterans, but in the wider community. So on that note, I think I'd like to say thank you, Anne. This has been really fascinating and informative. And I look forward to spending more time with you talking about how we can make the world a better place.
Absolutely. Thank you so much, David. I really appreciate your time and your kindness, and look forward to talking more.
All right. Thank you. I'm David King-Lassman. This is ExploreXR. Thank you.